Well, during the break period, the prorogation, as the government likes to call it, or the recalibration, whatever it was, we had a number of seminars within the Liberal caucus, one of which was on Alzheimer's and dementia. At that particular time, a man introduced himself, beautifully groomed, well-dressed, I thought a spokesperson for one of the dementia disease groups, be it Parkinson's, be it Hodgkin's, be it Alzheimer's. It turned out he announced that he, of course, was an Alzheimer's victim, 61 years old, found himself at the age of 58 in an airport, did not know who he was or where he was. When he reported this to his physician said, "Oh, well, you are stressed, you've been working very hard, it's probably just one of those moments." A few months later, walking his dog in his neighborhood, he realizes he doesn't know where he is, what he's doing. Goes back to his doctor and, of course, receives that diagnosis that, yes, he has Alzheimer's. He has to sell his business because he can no longer be assured of making the kind of decisions to move a business forward. In Canada, we tend to think of those as isolated cases, but they're not. The reality is that we're facing a huge growth in Alzheimer's disease in Canada, and we're doing very little about it. And while there is no cure for Alzheimer's or other associated dementias, we know that there are some practical things that Canadians can do. We know, for example, that if you increase your fitness level by 50%, and that doesn't mean running a marathon, that means going for a walk. It means perhaps swimming a couple of times a week. But if you're over 65 and you do not have dementia, and you begin to exercise more regularly, you will increase your chances of avoiding having dementias. If you eat well, not just over 65, but throughout your life, you will avoid the opportunity of having dementias. It doesn't mean that you won't, but your chances decrease considerably. Same's true if you monitor your blood pressure and you make sure that you're treated for that kind of blood pressure disease. The tragedy is that we are doing very little in Canada to promote that kind of programming. We talk about exercise programs for children, but we rarely talk about exercise program for adults and particularly for seniors. We talk about healthy eating more and more with respect to young people and getting junk food out of schools, for example, and all those things are very positive. But we don't talk about healthy eating in adults, and where it becomes particularly critical are those seniors who live alone and who tend to stop eating healthy lives because they're not cooking for other people. We don't have a strategy in Canada, a national strategy on Alzheimer's disease. We have strategies for diabetes. We have strategies for HIV/AIDS. We have strategies, in fact, in 13 areas, but we do not have a strategy for Alzheimer's and other dementias. And it's absolutely essential, because without having that kind of strategy led by the federal government with the presence and dominance of a strong national government, we are not going to be ready for the huge numbers of dementias. The average lifespan of a Canadian has now gone over 80. That's the average. If you live to be over 85 in Canada, 40% of Canadians will have some form of dementia. And if we don't do what we can to prevent that kind of thing happening, then the costs to Canada, not only in terms of the lack of viability of lives, but the actual physical cost, it is estimated could be something like $870 billion over the next 30 years. So it seems to me that we start spending smart. We start saying, okay, let's do what we can to avoid that price tag of $870 billion. And the Alzheimer's Society has indicated that if we put into places across this country the encouragement to exercise, to eat healthily, to make sure that we have control of our blood pressure, to put case managers in place to help people through those difficult steps when you're first diagnosed. If we put in some caregiver programming to help the caregivers, usually the spouse or children of the Alzheimer patient, to better cope and be able to keep that individual in the community as long as possible, then we will seriously curtail the costs of this. But if we do nothing, we know that the costs to the Canadian healthcare system, and therefore to the Canadian taxpayer, are going to be enormous.